Welcome, everybody. This is the Continuum, the podcast where we delve into authentic conversations about mental health. And I'm your host, Eva Wong. I'm the Executive Director of the Mayor's Office of Community Mental Health. And today is Mental Health Action Day. So we're so excited and honored to have our guest, Vanessa Nisperos, the Associate Program Director at the Academy for Community Behavioral Health with us. And Vanessa brings such a wealth of experience and a deeply rooted perspective. And her work is further enriched by her indigenous Mexican Filipino heritage, and her practices of indigenous spirituality inform her approach. And we're going to learn a little bit more about her work and her journey. But I want to just say that the Academy for Community Behavioral Health, it is a signature initiative of the Mayor's Office of Community Mental Health, or OCMH, as we call it. And we just launched, the Academy was launched in June of 2021 with city funding, and it's housed within the CUNY School of Professional Studies. And its mission is to equip community-based organizations and individuals who really care for the community, who are integrated in community with vital behavioral health tools, and is there to reimagine what care looks like in our community. So I am so excited to welcome you, Vanessa. We are happy to have you on the Continuum, and there's so much to discuss. Last time we connected, it was just so wonderful to see how much of our personal and also professional journeys have shaped a shared perspective on community mental health. And our title today is Community Mental Health in Action. And before we dive into conversation, I know that you wanted to start with an exercise together with us. So
yes, I'll give you absolutely. The time. Thank you so much for having me, Eva. It's wonderful to be in conversation. And one of the things that comes to mind for me, when we think about action, we can think about things external to us, like many actions that we can take. In the world we live in today, so many actions are necessary to protect those most vulnerable. But sometimes action can also just mean shifting our focus, shifting our breath. And so I wanted just to open with a simple breathing exercise for you and I both. You know, we're busy people in the world, and for anybody who might be listening, for all the people that they care for and hold as well. And so I invite you to just join me in taking a deep breath. Breathing in and just noticing how your body shifts as you breathe deeply. And we're going to do that for 3 more times. Just breathing in deeply into your torso. And letting it go with ease, not holding the breath in any particular way, not forcing it. Just noticing our body automatically goes into breathing. But what does it mean to take action and take intention with that breath? And on your 3rd inhale and exhale, just scanning inside of you to ask, what is it that I might need? Perhaps it's later in the day for some people as they're listening. Perhaps you're on your way home. Do I need to stretch or move? Do I need to hydrate? Do I need a little bit more rest? And so that was my offering. And when we think about Mental Health Day of Action, what are the actions that we're even taking to centering our own care and our well-being? And even those little shifts in noticing what our bodies need allow us to expand and be compassionate to others. And for some of us, that's the clients that we serve every day, the teams we manage. For some of us, it's the children we go home to after this long day of work. So there's always space for us to breathe into that and lean into compassion for ourselves, and to know that that's an extension then to the compassion we're able to offer others.
Yes, thank you, Vanessa. I love that idea of really we are together in community, and how you really pausing so you can have compassion for self and for others. And I mentioned that when we last connected, it was really struck me of how there's so much that we have in common of how we see our work and our community and mental health. And I would love the gift of you just giving us, and also the gift of you sharing maybe a bit of your own story of strength and healing, and so that our listeners can understand, as we continue to talk, how you got to this place.
Yeah, absolutely. I think one of the things that I keep in mind when I think about how I got to be on this journey to becoming, I'm trained as a social worker. I went to the Hunter Silberman School of Social Work, and the community organizing department there definitely attracted me to coming to New York to study within the Hunter campus. And I think one of the things that really drives my commitment to supporting people is that I was somebody who was supported by others at really key moments in my life. And I think there's something, sometimes we tread the line as professionals, like what do we share about ourselves and what do we not share? How do we keep professional boundaries? And social workers were trained to think about the professional use of self. If I'm going to share something, is it useful for others to hear, or am I using a space to process? And so I think about this conversation we have around stigma and shame in our community around accessing mental health. And sometimes we don't know that the colleagues that we're sitting with every day have actually survived some pretty terrible things ourselves. And I'm one of those people. I went through some real difficulties as a child, and I went through family removal. I went through the family foster care system and went through placement at a young age. And so my teenage years were spent in a lot of disarray. I think of that as really forming what made me really skillful working with young people that were considered troubled in different systems was that I had a really tumultuous childhood and had to find my footing along with adults that really looked out for me. Sometimes those were family members, like an aunt that really took care of me and took me under her wing. And sometimes there were people that were advocates or social service providers, like a lawyer that helped me go through the process of emancipating out of the system. And so there was a lot of key moments where I received support that allowed me to succeed and become sort of what is considered an outlier in the child welfare system, like somebody that goes on to complete college and goes on to complete master's level education is not common. And so a lot of that brought me to the point of really understanding how to care well for other people. And this is sort of where our paths first crossed, Eva, during the Connections to Care days under the de Blasio administration and working in community mental health. But it is one of the things that always stuck with me as a young person who had to advocate so much for myself, that there are so many barriers that people face that sometimes are just so unnecessary and sometimes end up being roadblocks that trip people up from moving forward in life and succeeding in life. And so I think there's a deep sense of one, respect and reverence for people for the things that they've survived. And so when I learned in social work, oh, that's called strengths-based approach. That's something that is valuable. I was like, oh, that's something that I really hold dear and like central to my worldview. And the other is advocacy for those who have less power and less privilege, like those of us that do make it to positions of power and privilege. We just, owe a great debt to those that came before us and had to fight against so many barriers. And so it's sort of the pay it forward mentality that how do we continue to advocate? How do we continue to push for improvements for those that really are left to such a disadvantage and left out of system sometimes.
Thank you for that. I think the word advocacy is something that those of us in kind of human services, kind of supporting people, social work, mental health, we use a lot, but I don't think we can take for granted what it means for someone who's in the middle of distress and difficulty to be able to advocate. It takes a lot. And you talk about people who really alongside you. A lot of that probably are strength that you have within yourself, resilience that we talk about, but it's not something I think we can just take for granted that you should just speak up, right? We often work with other young people or community and marginalized community. What does it take for someone to be able to advocate? And it is not an easy thing. And I love how you think about how you become who you are, how much of that strength is within yourself. What are the other elements that you required also along the way? So people, you had that footing. I love that word and the visual of that. And you also uplifted some of the sort of the principles and things that you really live by now as you are really influencing and supporting community in the way you do work. So really thank you. So I have a couple questions here, and I think you already touched on this of the type of principles and things that guide your approach to work. If you want to add on that, how those principles that you live by or core values that have informed the work that you do in individual and community and system, if you want to add to that. But another part of the question is just the idea that we both share. We know marginalized community often when we talk about sometime in conversation, we talk about what the needs are, the unmet needs, or maybe what the challenges and the gaps, and you already touch on, right? What is the strength base? So we understand that because we are ourselves are from communities, marginalized community, they possess unique strength. And within the cultural framework, how do we look at what maybe they themselves are living with within their culture, or understanding how people cope and how people maybe maintain and reach mental well-being. Like when you think about that, what comes up for you, and how does that look like in your work?
Yeah, those are wonderful questions. And so I really encourage folks, if you're not already connected to the Academy for Community Behavioral Health, I'm really hoping that folks can find their way to trainings there, because one of the things that's so central in our work is one, like making sure that all providers have access to high quality trainings. I think those of us that went into like counseling and mental health, we do have requirements to be in training continually, but for folks that might be in other frontline roles, there's not often a lot of focus put on professional development. A lot of folks don't have it in their budget to lift up professional development for all staff. So we offer free training for social service providers in any role. It does not matter if you're a front desk worker or a custodian at a school. You're somebody that comes in contact with community members. And sometimes, interestingly, the most trusted relationships are with folks in the non-clinical roles. And so we believe that everybody should have access to like free new information, skill building and practice building and knowledge building. And the other thing that we really believe in is also really centering the capabilities of communities. So we're not here to just like kind of stuff people's heads full of information. We're creating an environment where folks are able to reflect on the things that they do really well and identify the strengths and the things that they bring. And maybe we have terminology for it. Maybe we call it resilience or strengths brace, but there are some people that are already really great at supporting others and really seeing the strength that they have in them. And the other piece, the other half of supporting community capabilities is also honoring not just that oftentimes frontline workers have such strong and trusting relationships with community members, but also that they're already holding some skills that support their healing and well-being. And how do we know that? How's that evidence-based? Well, they show up to work. They're going through the same hardships as everyone else in the community, and they show up and they've probably gone through hardships in their lives. We do know from research that people in the social service sector have unfortunately higher rates of primary trauma and PTSD than the general population. So we're a group of people who are committed to this work because we've gone through some things. And so the ways that we have had to navigate our own lives, finding our way to some of the helpers that we know and we lift up, like clinical supporters, but also finding ways to connect to other systems of meaning. Sometimes I hear from providers that their church group every Sunday is where they find solace and connection. Some people say just cooking a big meal for family is what's really healing for them. And so there are all these ways that folks are centering well-being, centering joy and movement, dance, singing, things that really are evidence-based to center the nervous system and to calm. And yet they didn't go to school to learn that that was evidence-based. People who have had the ability to trust their own body and to find things that centered them and support their wellness, sometimes they've developed that into a practice. So we do also in the academy look to our learners to see what's working for them. We also employ a system of co-design where we ask people, like, what is it that you want to learn about? What's the best way to teach people this subject? And we take that information to heart. It's every workshop I've ever gone to, or most of them, they've had this post survey, like, how good of a job did we do? And sometimes you never know if it goes anywhere, if anybody actually reads it. But at the academy, we really do comb over that information and sit with it. Like, what are we putting out for communities that's really meeting a need, and what are people saying they really need right now? And some of the things that communities are naming that they need is really processing grief and loss, processing the stressors that they're under, especially with budget cuts that are impacting programs. And so how do we then rise up to that challenge and bring in more tools that help to mitigate the everyday stressors that people are holding, and also make space to name the grief and to process the grief that people may be feeling as disruptions occur, or as their communities are coming under attack. That's very real pain that people feel. It's not just an emotional pain. It has a biological impact in terms of the stress that they carry.
I think about what you just talked about. You shared a lot, and a lot of you're really uplifting a very essential part of our care system. And I love how you talk about it. And I know both of us have chosen, maybe had the resources or were able to go to grad school and get a certain degree, but we both share this view that we have people who are not the licensed trained professional, but they are really doing work that really cannot be, you cannot study into it, right? Because they have the experience, whether it is peer support worker or community health workers, and they have many different titles in the community because they are from the community. And the way you talk about why they're so important is, right, that what they possess within the capability. And I think about the academy, like it really was started meant for those who are doing this work day to day. They might not be recognized as doing mental health work, but that's within the system how we're used to talking about the workforce, right? We're used to kind of imagine that these are people licensed or trained to take care of people. And maybe when I was really working more full time as a clinician, I'm sitting in a room. How many times am I seeing my clients? Maybe once a week, right? Maybe there's a phone call in between. But our family specialist or youth worker, they are probably sometimes 5 days a week. They're interfacing with other children, youth, or family caregivers, and and often when they're from community themselves, that capability or that capacity that you speak to, I think is just so not, maybe we don't give enough like respect and honor for those people who are really cornerstones in our community. And the fact that this training, the academy really being there is, of course, to bring the new learning and skills, but also you talk about the co-design process, right? So that they are really informing where they see maybe there are certain skills that they want to continue to kind of hone in, but the skill that they already possess, and or what I have seen when I maybe done trainings, mental health training and such, folks are saying, oh, I actually have been doing some of this. And I wonder what it's like to be doing this work, but not been told that you're doing the work well, and getting the validation, right? To know that, oh, I'm not just wondering, am I doing it right? That is itself can be stress inducing, right? If you're daily carrying someone else's load, trying your best to care for them, but you're not quite sure you're doing it right. And just coming into a community of learning space where you are, oh, okay, what I'm doing is actually there's evidence to it, or this is best practice. Those are words a lot of time is just science kind of catching up on what community have been doing
That's a
for
good way to
decades and
frame
years,
it.
right? And or
Absolutely.
hundreds of years or thousands of years. So I love just hearing you talk about how your experience and how you really are pouring into the community in this way, and it's just really bi-directional of the learning, and all of it is just how do we provide community compassion care in a space together. And in my office, and I think about it is the name is community mental health because we believe that well-being, right? We can have many self-practice. We want that to people to have skills, but how much of it can be replicated just on my own in my own space, right? There's purpose and meaning when we are maybe within our own spirituality and isolation. There's goodness to that. But when we're in community, we feel connected, especially when we get a sense of belonging, right? And
Yes,
have a sense of
absolutely.
purpose. That those are really elements that really kind of keep us strong as well. So
Yeah.
thank you
If I could
for
share
so
too,
much. Yeah,
um,
absolutely.
as you were saying that, two stories that came to mind for me in terms of the value of being in community. So one of the wonderful initiatives that we were able to lift up with the support of your office, the Office of Community Mental Health in New York City Opportunity, supported us in piloting a youth mental health advocate program. And
Mm,
in the process of identifying young people who really had been able to access mental health and well-being on their own and felt like they were really passionate about making sure mental health access is freely available for their peers. We got to work with the cohort and bring in some trainings. And one story I remember hearing, one of our advocates was mentioning really walking through and being the first line of contact for somebody who was at risk of self-harm and was experiencing suicidal ideation. And this young man said, instinctively, he just knew not to leave his friend alone and walked with him and talked with him and made sure that he was safe and he got to a safe place. And I was just thinking that wow, in your heart, there's some goodness in you, there's some instinct in you that really directed you to know how to do this thing that many of us like go to school for and train for many, many years for. Like, how did this young man know that? And in talking about it and lifting it up, it's really in community that we get somebody holding up a mirror to show us like, oh, we're really expert at something. We're really um, holding really sacred and trusting relationships with people. And that's an expertise, that's a
Mm,
skill. In his mind, he was like, oh, I'm being a good friend. Actually, you are being a good friend. And that's something that like a clinician would also have done. So honoring like, you are somebody who is very caring and has strong instincts, and that's going to serve you well in this profession. And the other certificates and training and degrees, that's all extra. It's going to support and scaffold, but there is a passion and a sort of instinct and a love for other people that comes with us into this field.
mm. Yeah, it's recognizing certain things where it is a gift and you can continue to develop and add on skills. Some people are naturally caregivers, right? Or maybe it's because of the family structure. And when we look at our profession, how many people chosen to, it's because there is something along the way, right? Where they probably, you meet a social worker, you meet a therapist, probably there are stories they can tell you why they've chosen to, because they maybe received help along the way, or maybe they didn't receive the right kind of help along the way and they
That's
wanted
another
to
new
be,
segment.
right? Yeah, thank you so much. Um, I want to just kind of keep talking about, we talk a lot about, it's hard to kind of separate your life and your journey and your wisdom, and also your work, because I know you put that into your work. We talk a lot about Academy already. Is there more maybe with that through the programs and strategies that the Academy has been implementing that you would say you can kind of uplift for our listener, whether more success stories or key learning that as those who are listening, maybe they are working nonprofit, maybe they're not yet in um, social service or human service, but to keep in mind, um, whether it is a strategy or program or principles that you want folks to kind of keep
Yes,
top of mind for them.
absolutely. I think there's a few pieces of key learning that I would lift up. And one thing that I maybe didn't share in the beginning of the academy. So when you all got together and said training and technical assistance is something really valuable, we're going to support this. I came on initially as a trainer and I was invited to develop new trainings. And so one of the ones that I felt really called to, especially in the midst of the pandemic, was really creating space to talk about um, mass level trauma, like harm, and how, what the impact is, what's the lingering impact that that has on us. And the course that I developed, Deep Roots, was really popular in terms of people being able to put together that healing trauma. There's valuable work that happens in a clinical counseling setting, and there's so much additional work that's happening in community with um, creating more empowering context for communities, gathering with communities and creating spaces where we love and cultivate belonging, and being able to even challenge the systems that have created systemic harms so that those harms are reduced or ended in the future.
Mm,
So, in that sense, advocacy, like capital A advocacy, going to change the systems of harm, is also a form of trauma healing for these large
mm,
scale harms like systemic harm, historic and intergenerational traumas. And so I think one of the things that came out of those conversations, and we recently changed the course to include presentations from everybody in the cohort, because people would stay after our session for a few minutes. And sometimes I'd hear incredible stories, like people saying, I come from a lineage of healers, and I never thought of that as a connection to me being a social worker, or, things that they just held as strengths. And we thought, this is something that should be lifted up for everyone to see and witness. And so you were speaking so beautifully to the idea of belonging. There is a way that when we're in community, not just in our silo with me and my one organization and my one program, but hearing from our peers and our colleagues, that we start to have aha moments. Oh, I'm not the only one experiencing this like risk of burnout and these program pressures. So I'm not crazy. This is actually a huge stress. But two, oh, I've heard this colleague talk about something that they did in their family or their grandmothers taught them, and oh, I have the same thing. I never thought of that as well-being. And so my co-facilitator for that course is a really lovely person, Julia Bennett, who is an acupuncturist, and she's trained in traditional Chinese medicine. And so we've created a really incredible space where we talk about the biological process of stress, the literal what's happening to your body when you're under increased stress or experiencing trauma. And then what are the things that people have done, like you said earlier, for hundreds of years, thousands of years in communities that have experienced intense stress. And this last cohort that we just completed, people talked about traditional dance from their cultures, talked about knowing about their ethnicity but not looking into it, and then finding out their ethnicity included like native traditions and connecting to that for the first time. Folks had just such an incredible, enriching experience listening and witnessing each other. There were songs, there were poems. It was just an incredible experience. And I was thinking about how the course would have been one thing if it was just our idea, but when we bring others into the fold to co-create with us, it's like a seed almost. Like you don't know what plant is going to grow out of that, but it ends up being a really beautiful process. And so the key learning there is like, one, people really do want to talk about harm and really do want to talk about trauma. And two, the clinical setting, the evidence basis for healing trauma is just being so rapidly expanded upon by folks that are looking at, community resilience, community strength, collective healing practices. These things have really scaffolded and kept people alive through incredible hardship for so long. And it feels really wonderful and affirming to get to name that for folks. Like, you're here because somebody had some practices for wellness somewhere down your lineage. If not, we wouldn't have come here with all of the stories that we have and survived the hardships that we've survived.
And when we last talked, and you touch on it here as well, of what it's like to be harmed by systems, or maybe kind of someone in your family have tried to get some support somewhere and they had a bad experience, or maybe even with your own story, what it's like there is removal. And if that was done, right, we of course think about this still happens for different reasons. And when that reason that you have been in touch with the system is one that maybe really left you feeling even more broken, or maybe because it was a time of distress and it was trauma, what the value of community mental health, how much value there is, how much more powerful when someone don't have to enter into the conversation of mental health through these traditional spaces, right? When we're able to recognize that well-being and mental health exist not just in the medical world or within the social service system. How do we look at, because my office, of course, we look at the gaps that are within mental health system, and we believe the system is there, right, continue to be improved, right? There is, of course, room purpose very needed for our community, but also what it's like to kind of enter in a different way, where we are looking at practices that are rooted in community, in the tradition, in the heritage, and also to say that we also recognize this, right? You are doing important work. That a lot of nonprofits are doing that work, that's supporting community. How can we continue to put more resources there? And that at some point, right, these two kind of systems, so to speak, support system kind of come together, and how you and I are in spaces that maybe can kind of facilitate that, the healing maybe of the system, improvement of the system, but individuals kind of coming into it where they find that I don't have to, right? The only time that we think about it is, okay, go talk to a therapist. You talk about faith leaders earlier, and I also work a lot with faith community, and I've seen how we kind of assume that, well, faith leaders, clergies, you interact with a lot of people in your congregation or people who are practitioners or your patrons, and can you just refer them if they need some sort of, no, like I don't really believe that we only refer to the so-called professionals, right? How do we really honor in your spirituality, in all your wellness practices, whether it is the breath work that comes from, right, their traditions, or maybe mindfulness, how do we honor those and say that we had learned from each other, right? A lot of times I think now we're integrating more of this kind of traditional practices into the clinical work, because we're finally catching up on, oh, the regular way that maybe I have learned in school myself, as I'm speaking just for myself as a clinician, that doesn't speak to many people in community, right? So how we continue as professional doing the work, continue to really kind of have to learn and be open-minded, right? And also how communities maybe can see that you have so much that you can teach us, and so much of what you do, just really valuing, kind of getting connected to your roots. I'm hearing that, right? And just so much that I think we can continue to talk about. But I know that we don't have all day. You have other things happening. Is there anything that maybe I didn't ask, or maybe that a word of encouragement or word of like call to action that you might have for our listener, so that they themselves can maybe in their different space continue to promote, which is really the theme here, mental health equity and inclusivity. Is there anything else that you're at? And before we wrapped our time together?
Yes, just one thing that I wanted to add as a brief recognition, like a lot of the things that I talk about, I didn't come to on my own. I've gotten the incredible privilege to learn from some amazing leaders. And one of them, a mentor of mine, Esperanza Martel, is a leader she's based in Manhattan in the Bronx, and she really taught a whole cohort of folks to tap into the felt sense of what it means to heal in
Mm,
community. And you would love her because her work is really the precursor, I think, to Office of Community Mental Health. And we would learn to process the energies in our bodies. And she would always say, there's actually master's programs you can go to school for, like somatic therapy. And she'd say, don't call it that. It's called healing in community. When you're able to be witnessed by somebody and face that incredibly fearful place in you, that place that's held so much pain, and somebody's witnessing you and you know it's not going to kill you, they're holding your hand, you get to move through and break through and know a greater part of yourself. And so I really do encourage folks that if there's anything in this conversation that sparked your curiosity, that we just really dive deep into our practice for ourselves. And that's where we get expertise. Like I went through the process of healing the harms that I went through in my life, and that gave me the signposts on the trail for how I know to navigate really painful situations. And this is, of course, the supplement to all the training, the degree programs, and everything is to really be rooted, like deeply rooted into the healing of our own pains so that we have the ability to not pass those pains on to people around us or our families. And then the lived expertise of our own bodies as we're helping people navigate some really painful situations.
I want to leave that as food for thought for our listeners. So I'm
Thank
just
you.
going to end by thanking you, and just
Thank
so much
you.
appreciation for sharing so much of your wisdom and your knowledge and your own journey and your yes, this just very appreciative of it, and encourage folks to definitely look for the links that I know we're going to put down, including Mayor's Office Mental Health, Community Mental Health. We would leave the link so that you can also get to the academy to look at
Thank you.
what there is to learn. And there are a lot of resources as well for this month, for Mental Health Awareness Month, to kind of amplify mental health, things you can do even today. I know City Hall is going to be green. If you're not listening on the 15th, this probably won't be green, but that's why I'm wearing green today. But it's just things that we want to put into, raising visibility, right? That we continue to normalize mental health. But I am just going to close this off and just thank you so much again, Vanessa.
Thank you so much for having me.